Commissioner for the Department of Health with the Bureau of Public Health Protection. We have Kathy Teresi, who's a principal sanitarian with the Department of Health. And I'm sorry, I'm looking at the wrong page. I apologize. We have Peter DeLucia, who is, I mentioned. We have Chris Lalak, who is a radiological health unit with the Department of Health. We have Chief Neil Caputo with the Westchester County Department of Emergency Services. And we have James Ferrara, who is the purchasing agent with the Westchester County Department of Finance. I'm going to hand it off to Peter, who is going to start us off. Thank you, Peter.
Thank you, Joe. Really appreciate it. PPE is a topic here, for everything we've been doing during this COVID emergency pandemic. And we've got some real great experts here today. One of the guys that I've been relying on during this for our fit testing, for our staff training, for everything has been Christopher Lalak. He's one of my seniors that are involved in the program. So I'm actually going to turn it over to him. He's got the expertise there. So he's going to kind of go over, some of our recommendations, what the different levels of PPE are, and things like that. So I'm just going to hand it over to Chris. I'm here to answer any questions and jump in if necessary. And then we also have our emergency service people that are going to be presenting, James and Neil, which are going to give you some really good information on, acquisition, basically people that, contracts, people we trust that we know are actually delivering what they're supposed to deliver. But I'll hand it over to Chris.
And Chris, before I let you jump in, I apologize in advance. I did forget to mention we are recording this session. So besides the fact that we're all going to be on our best behavior, we are recording this session so that we can edit it down. And between the presentations and the question and answer, we're going to attempt to turn it into a webinar with some supporting materials as well and put it up on the DOH website. We will be adding a lot of core information to the DOH website, guidance from the state, from the CDC, etc. So you may be able to answer some of the questions that come up by visiting the website. So with that in mind, I apologize, Chris, but over to you.
Thank you. So I'm here to talk about PPE. So I'm not wearing a mask at this moment. I'm sitting in my office. The door's closed. Nobody's around me. But whenever I walk around, I wear my mask. It would be a little bit difficult to talk right now anyway, but I do wear this around the office. If I were to go to the restroom or the copier, wherever, I'm wearing that. And that would be a standard cloth mask. And that's the kind of thing we would expect to see in the school from the students and the staff. Okay. I took a look at the New York State guidance. I'll just hold it up here real quick. I'm sure everybody saw that. And that specifically talks about what if there's a sick kid at school. And the first thing it says is go see the school nurse. So I think anywhere a sick student or a sick staff member is going to end up right at the nurse's office. And a big question is what PPE will that nurse be wearing? Okay. The first thing to think about is even if they're sent to the nurse's office, they need an area. They need an isolation area, something, somewhere where they could be by themselves but still be observed. And even a thought of having a sick student area and a healthy student area if you had to do some other in your workstation or medical procedures like some basic handing out of medication or something that a nurse might have to do. So first thing is maybe think about having an isolation area wherever possible. And if it's a big giant school, there's enough space, maybe even multiple areas. Yeah. So another thing to think about is I think staff members, according to that guidance, are sent to the nurse's office too. And if the school is, I guess, probably more rural, if they have a car, maybe they could even isolate in their car for a staff member. I think that would be the perfect spot. They're out of the way, especially if there's a parking lot right there. The nurse could maybe even see them right at their car. Okay, so that would be a consideration. But that doesn't work everywhere. The nurse will have to evaluate them, so then the thought is what PPE would the nurse wear? Okay, so I can't make this stuff up. I have to go with what the CDC, what's out there already. So the CDC does have a fantastic guide, and I'm going to hold it up here for a second, and then I'll read from it. These are all easily accessible right from their website. This is use personal protective equipment, PPE, when caring for a patient with confirmed or suspected COVID-19. So if a student is sent to the nurse's office, I don't know the exact symptoms. It could be anything, but it might be in that suspected COVID-19. And this came up earlier that you don't want to expose the nurse. So the best thing and the appropriate thing is for that nurse to be wearing PPE. Okay, so when I look at this guide right from the CDC, there's 4 things that are like the standard. It's a gown, gloves, face shield or goggles, N95 respirator preferred or face mask. Okay, so putting those together, there's easy ones. I have a disposable face shield right here, really cheap, one-time use. You could throw them away afterwards. Gowns, really thin material, but fluid-resistant gowns. They're slip-on, open in the back, tear off. They can be easily slipped on and torn off and thrown away. Gloves, I'm sure every nurse's office has loads of gloves. You know, here's just my standard pair that I have. Should be with the right size. 1 pair is generally considered acceptable. In some cases, nurses prefer to wear 2 pairs of gloves. All the guidances have 1 pair, but there's always that personal preference that's acceptable as well. Okay, and then N95. When I read the guidance again, the same guidance from the CDC, they say an N95 is preferred and that a face mask is an acceptable option, especially when N95 resources are not available or in limited quantity or in crisis mode, which we've been in. So, and I'm just this was the face mask I showed before. This is a cloth mask. Surgical mask is similar. Had it upside down, similar. It doesn't seal to your face. And then I have some N95 samples here. Here's one. They'll say NIOSH N95 right on them. They come in different shapes, different colors, but you look for that NIOSH N95. That proves that it's a reputable mask. It's been tested, approved. Okay. Some of them have a vent, like this one has a vent to it. It makes it a little easier to exhale.
Chris, I just want to jump in there. When you talk about N95s, I know we've been getting a lot of questions. KN95s, and a lot of them you'll see have the ear loops. And what we discovered that, you know, there's really no way to fit test and actually have a real N95 with a KN95 that has those ear loops. I think that's important because I think when they start sourcing and they're looking out for what to buy, if they're really looking for the N95, and I know you're going to talk about fit testing and specificity.
Sure.
So just want to throw that in there.
Okay, you bring up KN95. N95 is the United States version of approved respirator. KN95 is the Chinese version. So they're actually very similar. And maybe in some cases a KN95 could work. But there's, I think of them as like the Cadillac and the Chevy. You know, the N95s are the probably much preferred. That's the U.S. approval process. The Chinese manufactured KN95s, sometimes they're just lesser quality. And when you try to fit test, and we'll talk about that in a second, it's like prove that respirator seals. If you have a respirator that's even just a slightly lower quality, you have a lot of difficulty trying to pass a fit test. Okay, so an N95 has some consequences that go with it. Once you put N95 in your plan, some other regulations kick in. Okay, there's OSHA requirements. So your nurse is going to wear an N95, that's part of your procedure, then you need a respiratory protection plan, okay? And that's through OSHA or PESH, which is very similar, but through OSHA. And that's basically a specific plan to go over how you're going to wear respirators, how you're going to clean them, where you're going to get them, just the whole procedure to do with respirators, okay? Also with the N95, you need medical clearance. So there's also through OSHA, there's a questionnaire that the nurse would fill out, and something like 10 pages of questions about medical history, and then a medical doctor that would have to be submitted to a medical doctor to review, and they would have to clear that person to be well enough to wear an N95. Wearing an N95 is slightly difficult. So if you had severe asthma or something like that, some other conditions, maybe a N95 isn't for you, that it would just complicate your scenario. You'd have to be medically cleared to wear that. Okay. There's also, so respiratory protection plan, medical clearance, and there's also fit testing. So fit testing is where you systematically check to see that that respirator fits you. They're not one size fits all. And usually the quality N95s from the US tend to pass better than that KN95s. But even the N95s from the US, they don't fit everybody. Sometimes there's different sizes. There's hundreds of different models. So everybody's face is shaped slightly different, and you might need to try a few different sizes, 2 different models to get one that actually fits you. When you do a fit test, there's kind of 2 basic fit testing methods, qualitative and quantitative. So qualitative is really a taste test. You put your respirator on and you put a big hood over it, and we use nebulizers to fill that atmosphere in the hood, usually with a saccharin solution, and you would sort of, the respirator filter that out, and if it was somehow bypassing that respirator, that would show that it doesn't fit you well. You might have to try another one, another model. And for some people, there is a possibility that no respirator would fit them. Okay, the quantitative testing, so numeric testing, that's similar testing to prove that that respirator seals against your face, and you do that with a particle counter. So that is less preferred at this moment because it destroys a respirator. You look for particles in the air inside the respirator and particles in the air outside the respirator and compare those 2 numbers. So you have to perforate the respirator to do that, so you waste 1 mask in that process. Okay. And just a note, I see Pete has a goatee there. You couldn't have a goatee with the N95. I like to have a goatee too, but I shave it now. A small mustache like mine is acceptable, but a beard, a goatee, a large mustache, those won't work. There should be no hair between no facial hair between the respirator and the surface of your face. Okay. And there is, I guess, another option compared to an N95. It's a PAPR. It's a purified air purifying respirator, powered air purifying respirator, sorry. And that basically is a kind of hood you wear over your whole head, and air's pumped into it. So it doesn't really seal against your face, but it blows air past you so that air's always escaping out of there. So if someone really wanted a beard, couldn't pass fit testing, that would be another option. That's a PAPR, powered air purifying respirator. You still need the medical clearance and the respiratory protection plan, but there's no fit testing with that. And let me think what else I wanted to talk about was there's really a shortage of N95s now. They're hard to acquire. Even for the health department, they're hard to acquire. And the CDC has come out with some guidelines about extended use of those. So originally when they were made, they were meant for a one-time use. So, but you those days are gone because there's so few out there. So there probably would have to be a reuse of these. So trying to keep them clean. If they get fluid contaminated, they get dirty, they break. Those would exempt them from that. But there should be an effort to try to conserve those.
We all just jump in. We always talk about the 3 Ds: dirty, damp, or destroyed. So those are the 3 Ds. If they're dirty, damp, or destroyed, they're out. And the other thing is you want to be careful not to put them in a Ziploc bag or something like that where there's a lot of moisture, where they can get moldy and things like that. It's better to have them, out, dry. If you dry them in the sun too, things like that, it's a better scenario than you don't want to seal them or just keep them in a paper bag. That would be fine.
Okay, thank you, Pete. So the CDC also has a great guide on putting on PPE. It's right on their website, easy to find. This is sequence for putting on personal protection, PPE. And it's a sample. It doesn't have to be followed because there's sort of different organizations have done things different way. But it's really put the gown on, put the respirator on, put the face shield on, and put the gloves on. And then a specific way to take them off so you stay uncontaminated. The nurse would stay uncontaminated. And again, there's different organizations have historically done these slightly different, so it's a recommended way to remove them. Even the removal guide, or doffing, if you know that term, for removal, there's two suggested methods because there's a lot of methods out there. Even the way you take gloves on and off, or take gloves off, I should say, there's different methods. I'm sure every nurse out there knows a method and prefers one, but different methods, those are okay as long as that's a recognized method to remove gloves. Okay, there's great guidance on the CDC website. They talk about extended use, reuse of N95s. So if you end up having to go down that road, it's right there on their website. I also looked at that National Association of School Nurses, a fantastic guide there too, all about PPE and what their suggestions are. That was very helpful. And fit testing, I'll just kind of jump back to that a little bit. Fit testing is really done, it could be in-house, but it's often done by a private firm. And the county does have a list of fit testing companies, not a suggestion, not a recommendation, but they're out there. There's companies that would come to the school and do fit testing for the nurse or whoever needs it.
I think one thing, Chris, that we want to mention with fit testing is that once you're fit tested to a mask, it's only for that mask. So if you're fit tested, it's not like I'm fit tested for N95s. Well, no, as Chris mentioned in his presentation, there are multiple different types of N95s. 3M, for example, makes different kinds of N95. So it's for that specific number. So let's say there's an 1860, I believe is one that comes to mind. If you're fit tested for an 1860 small, then you're only fit tested for an 1860 small. If you run out of 1860 smalls, you cannot replace that with another N95 and know that you're fit tested. You'd have to get refit tested for another mask. So that'll go a little bit more with James and Neil when they're talking about making sure you order your supplies and getting your supplies so that you have enough of those masks to get you through your school year. So you really want to make sure that you have the masks that your staff are fit tested for. And once again, as Chris mentioned, what we're recommending clearly is for your nurse, for your nurse or your nursing staff, whoever's going to be in direct contact with a potential COVID case, someone that comes in sick and presenting symptoms, to, the advantage would be to have them fit tested and have N95s for that person to wear. I'm going to be speaking tomorrow about facilities and custodial and things like that, and I'm going to make the recommendation here, as I'll recommend tomorrow, the custodial staff, you should have 1 or 2 people possibly fit tested for N95s, because if there is an event where somebody at school gets sick, whether it's vomitous or diarrheal, that needs to be cleaned up, they're going to be the ones that have to do it, and that potentially, if it is an illness, you'd be better off, no matter what it may be, norovirus, COVID, anything, to be fit tested and have proper PPE, gloves, gown, booties, whatever, to be able to clean that event. So I just wanted to put those things out there. Sorry, Chris, go ahead.
Thank you. That was a good suggestion. Yes, and you're totally correct. The N95, you pass a fit test for that mask that size. It doesn't cover you for any other masks, and they're hard to acquire. So if you got only a select few of one kind, that's not the one to fit test on. It's to get a whole shipment of a certain kind and then fit test to that, so you have plenty. Okay. So those were all the topics that I was going to cover. Just wearing an N95 is more than just getting that mask. It's the protection, respiratory protection plan, it's the fit testing, it's the medical clearance. A lot goes into it. Just want to make sure everybody knows that. Okay.
Yeah. Chris, thank you. I mean, those are the key points there. I mean, having that plan, getting your people medically cleared, and then getting the fit testing done. The fit testing companies can assist you with that. If you have any questions, we're here to assist you with that. We don't have the capacity to test and to do this for all of our schools. We'd love to be able to, but that's why, we'll turn this over to James and Neil, and they can talk a little bit more, and we're here for questions.
Yeah, before you go on to that, though, I just wanted to note that the list of vendors, because there's, over the course of these workshops, there's going to be a number of areas where we're going to be talking about utilizing outside contracting vendors. We will make sure that there is access to those vendors list. I can't commit that we're going to put them up on the website at this point because it's not been completely decided, but we will make that information available. The best way you can help us to do that is each school should designate who their point person is going to be on PPE. There was a Survey Monkey sent out last week asking for that information. I would encourage you to revisit it because that's going to allow us to have a smoother chain of communication.
Yeah, can you hear me okay?
Yes.
Okay, sure. I'm Jim Ferrara, and I'm the Director of Purchasing for Westchester County. And, I just wanted to speak about a contract that we developed for a lot of our PPE needs and talk to you a little bit about it. We have about 25 different items, all the items that Chris spoke about and Peter. We even have the forehead thermometers, the non-contact forehead thermometers. We have hand sanitizers. We have masks. We have several different types. We have the N95, KN95. We have gloves. We have gowns. 25 items in all. And we created this contract more or less as a convenience contract for all our using departments in the county. Now, you as school districts, you're going to have one location that they'll probably all be delivered to, and you'll order in bulk. But in the county, we have many, many different locations and sites in different towns and villages. So, we created it as a convenience. So you can buy in bulk, or you can buy small quantities. Some of our using departments are 7, 8 people, and they only need a case of masks, let's say. We did indicate on the specifications when we solicited the bids that this was going to be the case. So I encourage the districts with purchasing personnel to solicit bids on your own as well. If you have the time, do it. You might get better prices. We think we did very well with our prices. Just as an example, I know we, for the masks, the disposable masks, I think we're getting them for 22 cents each. The surgical type masks, ear loop, 3-ply, 22 cents a mask. That's a pretty good price. We also have a reusable washable mask on this contract, and it's $6.50 each. $6.50 each, and these became really popular when we rolled this out. Most of our using departments are buying these because they can wear them over and over, a little wash, and they're not wearing out at all. So, if that can be worn for close to a year, which is what the vendor told us, but that remains to be seen, you get your money's worth out of that. And they're very comfortable. They're really comfortable, and they have the little metal strip that forms to your nose. People that wear glasses, have issues with the fogging up of the glasses when they wear the mask. So you're really looking for some sort of a tight fit. We have other items on there, the hand sanitizers. And if you are interested in a copy of this contract, you could do several things. You can either A, go to our westchestergov.com website, www.westchestergov.com, and then search under departments for the Bureau of Purchase and Supplies. That's us. And under that little website there, you'll find a copy of this contract. Or you can go to our Westchester County Shared Services portal, and it's called westchestershares.com. It's also available on that. Or you can email me directly, and I'll be happy to send you a copy of it. And my email address is jjf as in Frank, 4, the number 4, at westchestergov.com. Okay, and I'll repeat it one more time, jjf4 at westchestergov.com. And I'll be happy to send you a copy. So also, I know a lot of the school districts, if not all, have purchasing personnel, and the New York State Office of General Services has recently sent out a survey to all local governments and municipalities about their use of hand sanitizer. And because they're thinking of developing a statewide contract for hand sanitizer, all different sizes, gallon jugs, half-gallon jugs, 2-ounce bottle, 8-ounce bottle. So I would encourage your people to fill that out and send it to them. This is something they could develop soon and probably get an even better price if this is going to be rolled out to all of New York State. The other thing, too, is, when we started all this, and when Neil comes back online, he can tell you, it was crazy in the beginning. It was really crazy trying to get all this stuff. It was almost impossible. And, we worked constantly with Neil and his crew and the EOC. And, we were able to purchase from vendors that we never did business with before. They were coming to us because our vendors that we normally do business with, one popular vendor, W.W. Granger, who's been a great vendor for us for many, many years, they ran out immediately. They didn't have anything. So there were vendors or companies that their primary form of business wasn't even selling masks or hand sanitizers, but they went into that business because they had special connections with China, where a lot of the stuff is made and manufactured. And we were able to get it through them. Some of them, there were companies that we dealt with for other items, but then they were our go-to people for this stuff. So if you are thinking about ordering this stuff soon, I guess when you get the green light that schools will open, if that didn't happen already, I don't know. I don't think that happened yet. My wife is a teacher. She hasn't heard yet. You'd want to order right away. I would not wait. I would, if you're going to solicit bids on your own, do it immediately. If you're going to use our contract, do it immediately. Buy a lot if you can, if you have the space. Don't buy enough to last you 2 weeks and then figure every 2 weeks you're going to order more. That's not a good idea at all. And we learned that quickly. Well, we didn't make that mistake. We were ordering in large quantities, but then some of the vendors only had a limited supply. So we were just getting what we could.
I'm back on, Jim. Can you hear me?
Yes.
Okay, I'm fine. I just want to let you know I was back on.
Okay, yeah, I'm almost done, Neil. I'm going to turn it over to you. Also, I know one of the preferred sources that we're mandated to buy from, New York State Industries for the Disabled, they have half-gallon jugs of Purell, which people love, because most of the stuff we're buying are, brands that, not every household is familiar with, but it does meet the specifications. But they have Purell. We just ordered some from them a few weeks ago. But again, everything is depends on what their supply is. They could run out, especially if you all start ordering at once, even from the vendors we have on our own contract. You could find yourself in a situation where it's back ordered and they tell you it's a 4-week back order. And you don't want that to happen. So again, if you have any questions for me directly, I guess there's going to be a question and answer period at the end. I am not the expert on the actual PPE products. You've heard from Chris and you've heard from Peter. They know about the items. We just order what we are told to order, and we rely on them heavily for the specifications. So again, thank you, everyone, and I'll turn it back over to Joe or Neil.
I think we'll just go straight to Neil, and then we'll take a few questions at the end.
I'm sorry. I apologize for the technical. So my name is Neil Caputo. I'm Chief of Logistics here at the EOC for the event. When you're ordering PPE, like Jim was saying, we had to go to a lot of different vendors. We had a lot of vendors coming to us. What you have to watch out for is a lot of these vendors are looking for cash up front. There's no guarantee about getting stuff. So we did not do that. We followed our procurement protocol as best we could. We're doing 30-day net or buying from Amazon. We did buy some stuff through Amazon. Amazon does have products that we did buy from. So that's one thing you have to worry about. We did put together a list of vendors that we've dealt with. I believe they're going to send that out to all the schools. There's some vendors that just do gowns. There's some vendors who just do masks. There's vendors who do a little bit of everything, including wipes. Somebody had a question about the face shields. Face shields are like one of the easiest things to find right now. There's most of the ones you're getting, the very thin ones are disposable ones, which are good for one-time use. You might be able to clean them again with a bleach solution and use them a second time. If you want something sturdier, you would have to buy something of a little bit better quality that you could reuse a couple of times by washing it, assign it to one person and wash it, have them wash it daily with, the bleach and water solution or whatever the manufacturer recommends to wash them with a disinfectant. The surgical masks, you can get those pretty relatively. I just placed another order for surgical masks from the county vendor, and he has an estimated of 12 to 20 days before when I'll get my masks. So you have a big lead time on all these items. One of the hardest items to get is gloves. Some vendors are getting gloves back in. Some of the vendors that you might be dealing with might not have them, so you might have to go look to different vendors. If you're not looking for gloves for the nurse, if you're looking for gloves for your cleaning staff, we were able to source gloves through Lowe's, Home Depot's, Napa Auto Parts. They're the same nitrate gloves, but they're not medical grade, but they are good for cleaning up whatever you're going to need to clean, and they're good for like sorting mail and stuff like that. So that's another avenue to look at is you have to look at all these different options. And if you are going to purchase N95 masks, there is hundreds out there, all different makes, models. The first thing I would do is before you even purchase them is request a spec sheet. If you get a vendor who says they're going to sell you an N95 mask, I would request a spec sheet on it with the company's name, the item number, and the make number. And I would go onto the CDC website, and they have a list of manufacturers, approved manufacturers for COVID-19, if they're alternate or if they're primary use. And you want to make sure all the numbers match up. Some distributors will have like maybe the first three numbers and there'll be some letters that might be missing. You want to make sure you have all those numbers on there, and you'll get be able to pull it up, and it'll give you that it's approved to use for COVID-19. So that's what you want to ask for if you're going to be buying N95 masks. Like Pete and Chris said, there is so many different brands, and there's a lot of fakes out there. Right now, if somebody's going to try to sell you an 1860 N95 mask, those are very hard to come by. Very, very hard to come by. I've been in contact with the 3M manufacturer, and most of those are going right to the federal government as they come off the production line. Not too many are making out. So if somebody tells you they have hundreds of 1860s, I'd be very leery about that. They are going to be coming out with a new mask in the fall called the 1870 that is supposed to replace the 1860 or be equivalent to the 1860. So that is some of the things you have to look out for when you're buying. Just get your orders in as soon as possible. I really urge that because there is a big lead time on a lot of things. I was averaging a lead time anywhere between a month when this was happening to 2 months of a lead time to play catch up with ordering PPE. Right now, it's averaging for gloves, it's averaging 2 to 3 weeks to get gloves in. But you can, like I said, if you don't need medical gloves, you can find gloves in all these other places that are suitable to use. With that, if anybody has any questions, I'll be more than happy to help you.
All right, before we go to the questions, Pete, anything else that you want to add?
I think we covered it. I think there was some important, things there to realize about the, fit testing. Who needs the masks? Who doesn't need the masks? Fit testing is specific to the mask, and the fact that you just heard from Neil and Jim that there's, there's stuff out there, but you got to be careful what you get, and make sure you order enough quantity when you do it. Definitely you should be getting on, looking for the other masks that are available, your surgical masks or the cloth masks or things like that, because, masking is very important to this whole thing. Everybody needs to be masked. Not everybody needs the N95s. The N95s are going to be specific, like we said, for those people that are going to be coming in potential contact with an actual case. So we don't, there are not enough N95s available, nor does it make sense or does it need to be to have N95s for everybody. One of our doctors, Dr. Hewlett, who was on another presentation earlier today, I was speaking with earlier in a prep, talked about a case where just with regular masking, there's a study where there was someone who was a hairdresser that wound up being positive, that was working with clients, but all those clients were masked and they were always masked and there was no transmission of COVID. So that's what's very important. Remember, when you're masking without an N95, you're protecting other people from you. That's the key. That's why it's so important to mask and have it up over your nose. So that's why I think Chris mentioned when the nurse is working on a patient, it's so important for that patient, if possible, to be wearing a mask, because that's also giving double protection there, okay? So I know we've gone kind of long already. I just want to make sure we have time for questions. I saw a lot of little chat boxes popping up there, and I know Joe's been monitoring that, so why don't we go for some questions?
Yes, just to let folks know, in the chat box, we have put up the link to the Department of Health's new coronavirus page. We have, I believe Susan has noted that the purchase of this equipment can be reimbursed up to 75% by FEMA, and also she put up the link to the available to municipalities that we had talked about as far as being able to access our county contracts. In addition to that, a couple of questions that came up have to do with what can the county do to help the schools get fit testing for their staff. And Pete, you had talked about it a little bit, but just more specifically, outline for folks what the county can do in addition to outlining for them our limited capacity to be able to fit test everyone.
As far as what we can do is we have that list available of vendors for doing fit testing. You feel free. You could shoot an email to me. My email is ppd4 Peter David and a number 4 at westchestergov.com. And you could ask some questions and things like that, or I could try to hook you up with somebody. But as far as being able to do fit testing for your facility, at this point, we're not in a position that we can do that.
Okay, thank you. Just wanted to note that I had mentioned the Survey Monkey earlier. Somebody had requested it. Aviva just put in the contacts, in the chat box, the Survey Monkey link. So if you want to copy it from there and respond to the Survey Monkey, this will be very helpful for us as far as getting ourselves organized to be able to work with you. Other questions? There was a question about a lack of availability for N95 masks. Let's say the question was, what is an acceptable mask coverage for a school nurse if the N95s are not available? First and foremost, and I'll toss this back to you guys. First and foremost, what is needed for these various positions is outlined in the guidance that came from the state. That doesn't leave us a lot of wiggle room, but we can work with you to problem solve. So what are your thoughts on that, Peter?
I think Chris mentioned it when he was reading the guidance that the N95 is preferred, but the face shield with the surgical mask will suffice, especially, in a situation where nothing else is available. So, the face shield is there to protect your eyes and for any splatter, and then you've got your mask underneath there. N95 respirator is preferred, but you can use a regular surgical mask. Just remember too, I've seen people wearing face shields without any mask. that doesn't make sense. Most of the time, the face shield is not needed unless, once again, you're in direct contact with a patient. When our nurses go out and we're actually doing nasal pharyngeal COVID testing, at that point, they're wearing a face shield and the mask. But when you see someone at a supermarket wearing a face shield, it's really, it's not appropriate. It's not needed.
Okay. All right, as I flip back through, that pretty much covers all of the questions that I had. I'm going to give anybody a minute to send me another question if they have one, and if not, we will only have been a couple minutes shy of the target. So,
well, the one thing I want to jump in and with all of this, when we talk about PPE, one of the biggest things still is proper hand hygiene. So we talk about glove use. Once you have your gloves on, they're now an extension of your hand. Now you're touching things with the gloves. If you touch your face with the gloves, it's the same thing as touching your face with your hands. So very, very important just to make sure you're not touching your face. Change those gloves often when you're wearing your PPE, change them properly, and nothing suffices, nothing beats proper hand washing. So lots of hand hygiene, the 20 seconds, the happy birthday song twice to yourself while you're thoroughly washing your hands, and using that hand sanitizer. As Jim said, there's contracts out there looking at a statewide contract to get that hand sanitizer and have plenty of it, so we can just kind of, increase the frequency of the kids. I've got two teenagers. I have teenage twins. I mean, to get them to wash their hands, and I'm the assistant health commissioner, it's not easy. To get them to clean the bathroom, my God, it's a nightmare. So you got to get on them and have that available. Have it at the cafeteria when they're coming out, if the cafeteria is going to wind up being used. Have it in the hallway. Have it at the entrance. Have it all around, because it's probably, look, once again, hand washing is great, but using that sanitizer is second best thing. And if it's out there available and they're using it when they're coming in and out of the classroom, they're going around, that's a very important PPE, is that hand hygiene, hand washing, and using the sanitizer. So once again, ordering is getting on the stick early and getting your supplies. Getting on there and ordering that hand sanitizer, ordering those masks, the surgical masks, reaching out to a fit testing company so that your nurses, your custodial staff, you can get a few people fit tested, see if they have some masks that they can fit test you with, so then you know what to order. Because it would be very hard to order something that's an N95 and then it may not be the right N95 for your staff. I saw that question pop up earlier when we were talking about ordering. So it's not that easy. And maybe, once again, maybe we could help get you a mask or two for fit testing purposes. That might be something we could maybe look into doing. I'm not sure. We'd have to look at what supplies we have. But once again, that's why Joe, with the Survey Monkey, getting that out there, what you need, we can look into seeing what we can manage. Like I said, I would love to be able to fit test all of you, but I don't think we have the resources. But maybe we can get a couple here or there done if you guys are in a real tight situation, because we do have the capacity. Chris is excellent at doing it. Always has that smiling face, and he'll be there with his shield and mask on if you wind up getting fit tested by Chris. But that's just a couple of little closing remarks I wanted to make. And thank you all. I think it's so important to have these and have you guys participate, so you have a little idea and you can pass that on to your staff of what's expected, especially in the PPE realm.
Pete, thank you so much. All right, folks, thank you all very much. I just wanted to add as a final comment, and Pete touched on this, we see this as a two-pronged process. The first one is helping all of you get ready and do what you need to do so that when you submit your plans later this week, you have all the information you need to do it. Once we get past the submission of plans and we're rolling forward, what we're really looking to do is, as much as we can at the county level, and that's the role of the work group, and that's the direction we have from the county executive, is to do what we can to help you effectuate your plans and to help you fulfill your plans as we move towards whatever your school plan and whatever your school reopening looks like. So this isn't a one-time thing. This is our way of getting us started and helping you, knowing that we'll do what we can to help you effectuate all of this. So thank you all.